First of all, I'd like to thank the Alliance for this opportunity to address the meeting. And I'd also like to thank Moira for setting things up nicely for me, because she's addressed issues and needs at end of life. Well, I'm going to move this on a step and report on findings of a study that we conducted earlier this year, exploring experience and awareness of bereavement support in family carers of people with motor neuron disease. So I'll just start with some background. I think we're probably all aware that bereavement encompasses a range of physical, psychological, and emotional symptoms. There are social and behavioural changes, as well as spiritual and philosophical challenges. We know that bereaved carers have worse health outcomes than comparable groups of non-bereaved individuals. And there's a greater likelihood of a negative outcome in bereavement in carers of people with advanced and progressive illness, like MND. Again, we're probably all aware that the effects of bereavement can be profound. But under normal circumstances, they usually start to begin to fade at around about 6 months after the death through normal coping mechanisms. However, up to 20% of bereaved individuals will experience a condition known as prolonged grief disorder, or PGD. And this is an intense and prolonged set of symptoms that are out of proportion to religious and cultural norms. They result in significant impairment of physical and/or psychological nature. PGD is an increasingly debilitating condition that can have serious consequences for the carer. There are similarities in the experience of PGD and normal bereavement, but the health consequences of PGD are much longer lasting and certainly far more severe. PGD is associated with a range of symptoms and conditions, including increased use of medicines and accessing healthcare, and increased absence from work. So there is a need to assess for clear, appropriate, and timely bereavement support for the provision of information and also for the use of interventions to help prevent or to ease the symptoms of PGD. Specific interventions designed for PGD are much better than generic bereavement support in addressing the problems associated with PGD. And so it's important to ensure that there is sufficient support available prior to the development of these pathological grief reactions, because the costs incurred in delivering pre-bereavement support are substantially less than the costs incurred in dealing with PGD once it has developed. So we wanted to carry out a study. Primarily, our intention was to understand what carers and professionals understood about the bereavement support that was available to them. We also wanted to know whether staff working with MND carers felt that they were actually able to accurately predict future cases of PGD. And we also wanted to know if the staff felt that there were any ways that they could be helped to predict future cases of PGD. I'm not going to dwell on the methods in any detail. I'm happy to talk about these later, but 15 minutes isn't very long to talk about everything that we did. But needless to say, all of the required approvals were obtained. We conducted 2 focus groups. The first one was with carers from a local carer centre who were caring or had cared for people with a range of conditions, but not MND. So I won't be reporting any of those findings now. The second focus group was conducted with a group of former MND family carers. We also distributed an electronic survey to a range of professionals, of health and social care professionals, who had involvement with people with MND. And we received 59 responses from a variety of different individuals. In our focus groups, the carers described the problems that faced them during their time of caring. They commented on the fact that they had little time for themselves, that they didn't put their own needs as a priority ahead of the person they were caring for. And if they ever did think about their own needs, they felt guilty for not thinking about the person with MND first. Caring for someone with MND was described as an isolating experience, and carers often felt overwhelmed by the progressive nature of the illness and the continuous losses that they were experiencing. Carers also reported that they had a change, a shift in their identity. They were no longer a spouse or a partner, they became a carer. And in doing so, they lost the understanding of who they were and what they were doing. And because of the progressive nature of MND, they reported that their experience was akin to a series of mini bereavements, as the person they were caring for continually lost abilities, and they were continually anticipating losses. We asked them about the assessments that they might have had while they were caring. And the responses were that they felt that assessments really were very informal. There was an awareness amongst the health professionals that the carers were the linchpin, that they were holding things together. They were ensuring that the person with MND was enabled to be cared for at home. But they didn't receive formal assessments, and often the assessment could be rather haphazard. We asked them about what type of support they had received, and they referred to support such as the hospice or the MND Association visitors, amongst other types of support. But these supports in particular were viewed as being really important because they provided opportunities to speak to people who maybe had similar experiences as them, and so they didn't feel quite so isolated. However, regardless of how much support was available, some carers just felt that they couldn't access it because they didn't regard their own needs as a priority. The priority to them, if they left the person with MND, was to go and do the shopping, to go and pay the bills. It certainly wasn't to have any of me time. I don't think I've done anything wrong. And similarly, if there was nobody to stand in for the carer, then no matter how many services were offered, nobody there to stand in for the carer and be there for the patient, then no amount of support services could help to ease the caring burden. So we asked the professionals a number of questions to determine their understanding of pre- and post-bereavement support available for carers of people with MND. And support from friends and family, as well as informational materials and befriending, were the most frequently reported amongst a range of other support mechanisms. We then asked the opinion of the pre-bereavement support that was available, and the majority of responses suggested that those services were average. But a number of people did report good or excellent services. However, in the range of about 40% of our respondents felt that the pre-bereavement support services were either fair or poor. And just to expand on that, the open text responses indicated that our respondents really felt unsure what was being offered at these services. The services were also quite limited, and there were no formal guidelines about what support was offered. We also wanted to know what the professionals' views about post-bereavement support were. So we asked them about the types of support that were available. And again, support from friends and family came out quite strongly, in addition to sort of signposting to other forms of support. But over 60% of our respondents telephoned bereaved carers following the death. And that was in addition to other support services that were available. So we asked them to give us their opinion of these post-bereavement support. And the responses were pretty similar to their opinions of the pre-bereavement support that was available. And just to elaborate on that, there was a sense that our respondents felt that carers were really left to sort things out for themselves. It was a DIY approach. We wanted to know what the duration of post-bereavement support was, and the majority of our respondents didn't know how long that would last for. But over a third of respondents felt that would be less than 3 months. And this is important because PGD can't presently be diagnosed earlier than 6 months following a bereavement. So there may be additional people out there suffering from PGD that aren't being recognised. We wanted to know whether these professionals had any experience of caring for somebody who had developed PGD. And quite interestingly, 41% of our respondents felt that they had. Now, if I remind you, earlier on I said that the experience of PGD is in the region of 10 to 20% of bereaved people will experience it. There's been one study published that looked at PGD in MND, and that was a very small study with only a sample of 16. And they recognised that PGD was probably apparent in 37.5% of cases. So our figures, even though it is a small study, support the notion that PGD is probably at a higher rate amongst MND carers than in the general population. We wanted to know whether the professionals were able to accurately predict future occurrences of PGD, and overwhelmingly the answer was no. We wanted to know whether there were ways in which they could be helped to predict future cases of PGD, and almost 40% said yes, there were, and that would involve education, provision of information, as well as maybe a one-page sheet with a tick box type of format that would help them to predict who might be susceptible. And that is work that we're currently working on. So we asked whether they felt that the implementation of a bereavement risk indicator tool would be worthwhile, and overwhelmingly the response was yes. And that's the subject of a bid that was put in for national funding, which hopefully, if there's any wood around here, I'm touching it, that we will find out within the next few days whether we have funding to take that project forward. So in summary, there is distinct room for improvement in both pre and post bereavement services for people with, for carers of people with motor neuron disease. We suspect that PGD is present at a higher rate in MND than it is in general populations. Health and social care professionals working with people with MND struggle to find those and to identify those people who are at risk of developing it. And there was considerable support for an alert system, some way of identifying carers at risk so that they can have appropriate and timely referrals. Thank you.
Thank you, Mary. Questions, please. Real interesting piece of research. Yes, I've got a person in the middle.
From Switzerland, ALS Clinic. Is there any correlation between patients who have cognitive dysfunction and the caregivers having a PGD? Are more prone to PGD or not? We have the impression, but we haven't got data on it. Just we suspect it.
I don't know at the moment. As I say, we are intending, funding permitting, to do a study to look at the prevalence of PGD amongst carers, and cognitive ability may well be one of the things that we're looking at in relation to that.
Okay, anywhere else? Okay, I've got one over there.
Gunnar from Iceland again. Question, did you see any correlation between how people, couples had acted or lived their life before and the prevalence of prolonged grief?
No, not in this study we didn't. It was a very small scale study in order to inform the bid that we've put in. So no, I can't answer that.
And anywhere else? One of the things I wondered in the focus group, Mary, was there any concern not just about sort of the bereavement aspects, but almost what some people refer to as double bereavement, because all support services stop as well?
It didn't come out in the focus group, but it is something that we have found in other studies that we've done, that yes, as soon as the person with MND dies, all services are withdrawn, and carers can feel bereft because they've had a lot of input from a lot of services, and then suddenly they're gone.
Mm-hmm. Yeah. And any other questions? Okay, then join me in thanking Mary for her presentation this afternoon. Thank you.